Welcome to Autism Approved, brought to you by Enzymedica. Now here's your host, Kristin Selby-Gonzalez.
Hi, this is Kristin Selby-Gonzalez, and you are watching Autism Approved. Right now, we are so excited because we are at AutismOne in Chicago, and we're going to be here doing kind of a series of talking to top experts and professionals in the autism community, asking them the same questions to try to get their perspective. Right now, we have the distinct honor of talking to Dr. Kyle Van Dyke, and he's here with us, and he's going to give us his kind of his answers to the questions that we have. So thank you for being here.
You're welcome. Thank you.
Can you give us a little bit of background on of where you went to school, kind of how you got into this field?
Sure. Again, Kyle Van Dyke. I went to medical school at the University of Chicago, then did residency at the University of Virginia in a family practice residency program. Did that for a number of years, working regular family practice, and then got drawn into the world of autism. And I've been doing this now for about 6 years.
Now, what experiences or was there one particular experience that inspired you to get into autism?
There was, and his name is Ryan. Yeah, my son. I was just practicing regular family medicine, doing all the regular stuff. And then my son started showing all these signs of developmental delays, and really, it was quite disturbing to us. I had never seen a child with autism in my entire medical training. I think I'd had maybe one patient in the clinic over the past 2 years or so before that who had autism back in that time, and this would be late 90s, right around 2000. And started seeing these things in my son, and I couldn't, it was very, very difficult to see your own child losing skills, having horrendous GI issues, muscular strength issues, not talking, not looking at us. It was very scary.
What age was that?
He was started to show signs less than a year old, and then, clearly by 2 years old there was a lot of stuff that was wrong, and he got his diagnosis shortly after 2 years old. And at that point I looked in all my books that I had. That was kind of pre-internet era for me, at least. And all the pediatric textbooks would just say there's nothing you can do about it, and when you look at the treatments it would just give you the different stages of denial, acceptance, and these kind of things, and looking for wishful cure kind of thing. So it made it look that even looking for a cure at that point was, you're kind of, being just going through your normal grieving stage when you're doing it.
It was almost like false hope.
Yeah, exactly. Yeah. And so that kind of delayed me for a long time in looking at stuff. But then eventually my wife and I kind of independently started looking at stuff and found things on the internet that started pointing towards doing diets and these things that people were doing. And she went and saw a nutritionist, and actually on the same day we kind of came to the conclusion, let's try a diet and see what helps, if this helps with our son. And we did it, and within 24 hours we started seeing dramatic changes in his personality.
Wow. And the diet you're talking about, was that the gluten-free?
At that time it was just milk-free that we were doing, because he was just drinking tons and tons of milk each day.
Wow.
And eventually we moved on to gluten-free as well, and a bunch of other different variations on that. But just seeing that one dramatic change in the first 24 hours is what really sold me that this is not an unchanging condition, but this is something that we might be able to make a dent in.
Now, how old is he today?
He's 9. Today.
9, and how is he doing?
He's doing very, very well. We started off, my son was completely nonverbal. He had horrendous diarrhea, 15 explosive bowel movements a day. He was, got pain all the time. The only thing he would do would sit and stare at the wall, and drool would come out of his mouth till it hit his knee, or he'd be spinning one of his toys, and that would be pretty much all he was doing back in the early days of the diagnosis. And now I catch myself all the time saying, "Be quiet, Ryan," and because he's talking so much now that he's like a regular little kid that you're sometimes just wanted to be quiet a little bit. Yeah. But things that I never thought that I would be having to say to my son. But he's he can talk now. He plays with his sister. He argues and fights with his sister. His gut is 100 times better than what it was before. He still has ongoing issues, and he's still not 100% better. But from the place where we came from with the diagnosis of severe autism, it's just been a phenomenal
So there was no such thing as false hope at that moment, right?
No. And I knew from when we first took the milk away and we saw him all of a sudden look at us for the first time, and it would have been ages by then, that, I knew that this is something that there's some, he's still in there. It's not, all hope is not lost.
Oh my gosh. So to me, like as I hear this story, because my son obviously has autism as well, we talked about that a little bit. And, you know, as a parent, and if you're a parent out there, I mean, it doesn't matter what state you live in. It doesn't matter what background you came from, what country you live in, really. You know, it affects all of us, right?
Yeah, and at the time I was actually living out on a little tiny island in the Western Pacific called Guam.
Wow.
So we had very little resources out there, but diet, something that everybody can do on their own. It's not, you can't possibly hurt a kid, so it's something that anybody listening could start their kid on
Right
tomorrow.
away.
Yeah.
Okay. And I think that's good for you guys to really think about, because what we feed our kids, we choose to feed them. You know, I mean, we're the ones that pick the foods, you know.
Yeah.
At 2 years of age, they're not cooking in the kitchen.
Yeah. Never gave them the car to go to the grocery store. Yeah.
Exactly. So I have another question for you. What do you think the first signs of autism that, you know, people might recognize before they even get a diagnosis? Because we get that question asked so often to us. I don't have a diagnosis, but yet it seems that my kid might be showing some characteristics.
Sure. The biggest things that I think most people recognize is when the kid's just not looking at them. You know, most little babies are, you know, always making good eye contact with you. So it's that kind of loss of eye contact or not interested in eye contact thing, which is always, you know, pretty concerning for parents. Certainly not developing language at the usual rate, and, you know, we see all the time where people are told, oh, he's just a late talker. Well, you know, late talkers run in the family. And that's probably just part of the genetic predisposition that was going on in that family. But particularly if you lose language, which is what happened to my son. He had a few words, mama, dada, kitty cat, and then he just went silent. He stopped saying stuff.
Okay.
And so when you lose language, that's one of the things that's really concerning. That's something you should see a doctor for right away. There's other things besides autism that can cause that, but that's certainly something that's real common. And the other thing, I guess, would be when they're just not playing with toys typically. You know, what my son would do would just spin everything. You could give him a toy truck, he'd turn it over and just spin the wheels.
Okay.
So that kind of using things in a, you know, in a just a stimming kind of way versus, you know, doing some kind of engaging play with it.
Okay.
Those are all things. And then, you know, certainly talked about the eye contact, but not wanting to play with other siblings, toddlers, that kind of stuff. You know, there's always things that you get.
If they're more isolated,
Yeah.
you know, wanting to be by themselves.
In their own world is something
Yeah.
that typically all the parents will say.
Where do they go to, like, I get that question asked. I mean, obviously I know, but, you know, from your expert opinion, where would somebody go to get the diagnosis?
Well, you can certainly, you know, go to your own family practice doctor, pediatrician. I've had, I don't know how many hundreds of times I've heard at this point where the parents have gone with their concerns and then the concerns are frequently dismissed. So you usually have to be quite persistent about that, and it's oftentimes not until a kid's getting really far behind that they really start to notice it. You know, your doc's only seeing the kid once every 3 to 6 months, you typically by the time that this would be, you know, developing. So you can, you know, just insist on getting either like an early intervention kind of evaluation by, you know, by the state people, you know, look at their, so you can get a kind of number as to where they are in their speech development, language development. You can ask for a referral to a developmental pediatrician or a pediatric neurologist, kind of depending on the area you're at. There's the people who will kind of make the formal diagnosis at that stage. But it's a lot of times you do have to be kind of insistent that no, he may be a late talker, but there may be something else going on.
I know that's what we had to. I mean, a lot of us are seeing things at 15 months of age and aren't getting the diagnosis, unfortunately, till 2.5 or 2. Mine was 2 years, 4 months. And we had him evaluated 3 times and they told us he was fine.
Yeah.
You know, we were told all those things. Maybe he was losing his hearing. We got the hearing checked. You know, and so he's, you know, Dr. Van Dyke is absolutely correct when he says, be persistent. You know, if you feel a gut feeling, especially as a mom or a dad, you know, don't ignore those red flags.
Yeah, and if a doc is ignoring when the parent is concerned about their child, particularly a mom's concerned that something's wrong with their child, that's a big sign right there that something is wrong if the mom thinks that the child's not developing right.
Absolutely, and that's a red flag, and, you know, definitely don't be afraid to change doctors, right?
Yeah, no, don't hesitate.
Yeah. So another question I have are, you know, when they first learn that their child has autism, do you have any advice for new families on where to begin when they are seeking help for their child? Like, what's some of the first things they should think about doing?
There's a great organization out there called TACA, Talk About Curing Autism, that my wife's got involved with. It's totally free to the parents. I really recommend you go to their website and look at that, because that's all free information. Like I said, a lot of the stuff that you can start doing with your kid, you don't necessarily have to see a doctor for. You can start doing on your own. And a lot of that information is out there available free. There's tons of information out there that may not be all that useful, but some of these organizations are really good about, you know, finding the stuff that is the most useful and getting that out to the parents.
I know Talk About Curing Autism has journey guides even,
Yes.
and they have a volume 1 and 2 depending on your child's age. And if your child's under 10, you would do volume 1. If your child's over 10, you do volume 2. These are free. I think that's a great organization to help get you on your way. And they're all over the country. So
They're in a lot of states now. They're expanding all the time. If you can't get to one of the local meetings, you can just go onto their website, and they have a lot of information there. So that's a fantastic resource for parents. Another good one is the ability to go to the different conferences that are around. These go on all, we're in Chicago now at the conferences. There's conferences that take place all around the country, smaller regional ones and stuff. Different groups may have speakers coming in from time to time. Local and state autism societies sometimes have that stuff. I'd have to be a little cautious though, because I remember the first time I went to a state autism conference. I went there to give a talk about this kind of stuff I was doing in terms of helping kids with autism. And some of the other speakers there were, of the opinion that, that autism is all genetics. There's nothing you can do about it but donate all your money to the genetic research and don't, listen to all these other people who are telling you about all the crazy stuff that's out there. And, if you go to places and hear the wrong information, that's going to set you back even further.
Absolutely.
Before you can find these things that are giving kids a lot of effective treatments.
So I think that's why when you're talking about organizations that have a lot of parents already involved,
Yes.
listen to what other people are doing. You don't have to reinvent the wheel.
Yeah.
If other kids you're seeing there's a common thread there, whether it be diet, it might not be the same diet, but there's a common thread that may be diet or different therapies and different things like that.
And certainly not everything works for every kid.
Yeah.
I mean, it's always nice. With me, the first thing we tried, we actually got a big wow out of, which
Yeah.
is always exciting. There are some parents that have done the diet for a long period of time and don't necessarily see anything.
Yeah.
I still find that in the minority, but there's there's people out there that do that. But every kid is different. Every kid's going to have something that's going to be helpful for them. There's a lot of stuff we have in our toolboxes now in terms of what can we do to help this kid get better. So if one thing doesn't work, there's still tons of stuff out there that we can try.
We're so lucky today, that there's so many great doctors like you that are out there and they're just like, we're not going to give up. We're just going to keep finding options. And I think that, you guys, is so important to be able to know that there's options out there. And you guys have done the homework, you've done the research. And so if we find people like you, it kind of helps us. To me, you're saving time off Google. And that's huge because we can get stuck on that computer for weeks and we don't know where to navigate and go.
Yeah, and that's probably one of the key things if you can get to see somebody who's got experience in doing this kind of stuff is they can help speed up the process kind of, by looking at your kid, seeing what the individual issues with your child is, kind of customizing everything so you can, not waste months, thinking maybe I'll try this. And if, you really think that this thing's going to help a child, you kind of push that intervention on them. I many times when new parents come into my room, I'm the first doctor that's ever given them any indication whatsoever that there's hope for their child. And I can see parents sometimes just start crying when I just start saying about, well, this is what we're going to do to help your child to start getting better. And they've been told, when my son was 3 years old, they were giving us pamphlets on homes that we can put him in when he gets older, so that he can be put away in a nice institution. And that's not something you want to think about with your 3-year-old son.
No.
So just having somebody out there that's giving you hope, and not false hope, but this is, we've seen tons and tons of patients who have gotten better. Some dramatically so, some maybe a little bit, but even a little bit for some families. You take a kid that's never slept in the past 20 years, and you can get him sleeping through the night. That's unbelievable
huge.
For that family. That's
Absolutely.
huge. I mean, he's not neurotypical yet, but he's getting a little bit better. And some kids, you can get them to the point where nobody ever knew that they had autism.
You're just climbing that ladder, and I think that with my son. My son's 10. He's not recovered, but he's getting better. And I'm like, as long as we keep going up that, up the ladder, then you know what? We're just going to keep going. Like there's really, what else do we have to do? I mean, this is my son. I got nowhere else to go, right? And I'm not going to give up on him. And if I never saw him ever get better in 10 years. Then you might think, okay, what other options is there to look at? I would never stop trying. But the fact if your kid's getting a little bit better, you know what? They're going to cross that finish line eventually. Some kids cross faster. But to me, it's like as long as they're taking those steps in the right direction, that's all that matters, right?
And every year, new stuff is coming out.
Yep.
Like in this past year and a half, there's been some fantastic work with cerebral folate autoantibodies. I hadn't heard about it at all, 2 years ago, and now we're seeing some kids making tremendous gains with this, which hadn't been around before.
Absolutely.
Other stuff that we worked with, again, it's only been going on for the past several years, when I first got into this, about 6 years ago now, a lot of this stuff wasn't around. A lot of this stuff was around, and it still works really well for a bunch of the kids. But then there's new things that come up all the time.
Absolutely, and that's why it's important for the doctors to be at these conferences. It's so important for them to continue their education. And I know I see you at every major conference. So
and I learn things at each conference too. There's new stuff. There's there's always somebody out there thinking up something new.
And that's important. Now, I have enjoyed so much talking with you. And before we end, I want to make sure that we kind of leave them with a message that's important to you. So based on what you've seen, based on what you've experienced, what message would you like to share with those watching and listening today?
Don't give up on your kid. There's tons of stuff out there that you can do now for your child that can help make your kid start getting better. And again, we can't say for sure, is this a kid that's going to go through the roof, get better right away, or is this somebody that we're going to see gradual improvements are? But there's things that you can do. There's docs out there who've been looking at these approaches. Get yourself familiar with people who are in your area. Go to somewhere if you need to. We moved from Guam to Virginia to get closer to somebody who knew what they were doing with autism. There's hope, is the bottom line for the parents. That just keep looking, and there's people out there that can help you. There's great parent organizations out there that can help you. There's great conferences that you can go to and learn all this stuff.
Absolutely. I think that is the message that we hope that you guys, really get from us. And if they want to find you, because I know that you have a very busy clinic and you help a lot of people from all over the world, not just where you're based, how do they find you?
I'm working at the Wisconsin Integrative Hyperbaric Center. It's in Fitchburg, Wisconsin, which is just right next to Madison, Wisconsin. They can go to our website, wisconsinhyperbarics.com, and learn more about our clinic. They can certainly look up. We have some of my lectures are online and stuff too, that they can learn more about my approach and what I'm doing, and talk at these conferences as well. So they can talk to us there as well.
Wonderful. Thank you so much for being here. And thank you guys for allowing us to bring hope into your homes. Until next time. Bye.
Thank you for joining us for Autism Approved with Kristin Selby Gonzalez. Please join us next week for another episode brought to you by Enzymedica.